I'm Jane Oddie, interviewing Dr. Shabana Chowdhury on behalf of Number One Health at Number One Harley Street. Hello, Shabana. Hi. Shabana, we just wanted to get to the bottom of some of the things that we're going to be doing today, like with GP care and what people is available for people when they come over here. Who from overseas is entitled to what in terms of the NHS?
Okay, well that's actually something that the government's quite clear about. It comes from the Department of Health. If you're EU country, then anyone is able to get treatment here of any kind. So it's chronic illness, emergency treatment, you're entitled to it. If you are someone who is visiting from overseas, but you don't normally not resident here, you are entitled to emergency or what's called immediately necessary treatment, which is up to the doctor to decide, but normally that's quite clear as to whether it needs treating. And the third category is people who you have to be defined as ordinary resident in the UK. And for that you have to fulfil the criteria of living here for at least 6 months and having an open-ended passport, which means basically that you've got a passport that you're able to be in for at least a year, basically, without any restrictions. Okay. If you don't fall into that category, then you wouldn't qualify for treatment. But asylum seekers are an exception. So if you're an asylum seeker, you get treatment.
Okay. So should some of those who are not entitled to UK GP think about private provision?
Absolutely. I think everyone should have GP. So if you're going to be here for a considerable length of time and you're not going to have access to a general practitioner, I think you should think about getting private healthcare.
Okay. And how easy is it to register with a GP in the UK?
It's actually very easy. I mean, you walk into a GP service within your catchment area. If you're not clear about that, you can ring the local health authority and they'll give you a list of the practices. And you walk in and register, basically.
Okay. And what if I find it very difficult to register? Who else can help me?
Okay, well, if you find it difficult for some reason, because their list is full or it's closed, you are entitled to ring the local health authority and they can allocate you to a surgery in the area, and then they have to take you.
Okay. So what is the general principle of the NHS in regard to travel vaccines?
Travel vaccines in NHS are offered, but only basic ones. So you are entitled to the tetanus and hepatitis A, typhoid, those kinds of vaccines. And a lot of GP surgeries are now yellow fever centres. Where I work, it's a yellow fever centre, so they get certain training, and we do give yellow fever, and these vaccines are all given free. But vaccines such as rabies or tick-borne encephalitis, all sort of special exotic ones, you would have to pay for or go to a private travel clinic.
Okay, so and what is the general principle of the NHS with regards to anti-malarials?
Free. On the whole, they're free. The only one that's up for debate is Marrow, because it is expensive. And initially when it came out, practices were told to charge for it as a private prescription.
How expensive is it?
How much is Marrow? I'm trying to think. It is pretty pricey. I mean, when you think a normal prescription is about £6.70 per item, Marrow is probably at least 4 times that, I'm guessing. I don't know the exact private price.
It does cover you completely when you're travelling?
Yeah.
Okay. So, and what is the general principle of the NHS with regard to health screenings?
With regard to, just can I just go back to the Marrow thing? So
yes.
Just to finish saying that. Initially, it was basically declared that it should be charged for, but now a lot of the local PCTs are deciding that actually we should give it for free because people are coming back with malaria and it's becoming a public health concern.
Okay.
So a lot of London PCTs, for example, should give it out for free.
Okay, thanks for that one. And as I say, we're going back to the general principle of the NHS regarding health screenings.
Yeah, health screening is very different on the NHS, as I'm sure you know. It's very much targeted at different practice populations. So it's targeted at, for example, we have cervical smears, we have mammograms, and that's certain conditions. And it's looked at from a kind of cost-effective and clinical effective balance, really, because it's costly, so it has to be worth doing with a high pickup rate. The other kind of health screening done in the NHS is children, child health surveillance, elderly, mental health, and if someone's got chronic disease, it's monitored. But other kind of health screening, like you get privately, so the corporate health screening, doesn't really exist on the NHS. However, if someone who's over 40 walks into a surgery and says, I want a health check, it's kind of discretionary, and you would go through their family history and offer them tests and, basic tests, basically.
Okay, so quite comprehensive.
Yeah, I mean, you know, body mass index, blood pressure, urine,
Yeah.
do some basic bloods, give them advice on lifestyle. But you're not going to start doing exercise tests and sort of fancy scans unless it's clinically indicated because of the cost side of it.
If I'm pregnant and overseas, what should I do in terms of NHS care?
Again, if you are not ordinarily resident, which is what I said, what I explained earlier, you would only get it if you'd only get it qualified, and if you didn't qualify, then I think it's really only if there's an emergency. So you can get routine antenatal care if you weren't ordinarily resident, but if you were in labour or you were bleeding, you know, the NHS obviously you would be treated.
Okay, so there are problems, complications.
Yeah.
Okay. And if I leave the UK for 2 to 3 months and I'm on regular medication, what can my NHS prescription do for me?
This is, I mean, up until recently, 3 months is what the government recommended for repeat prescriptions, and recently they've been asking us to try and give 2 months because it's being abused or people aren't being monitored. I do it very much on a patient basis. You know, if I've got a patient who's sensible, I know them well, I will give them up to 3 months, and if they're going away to travel for 6 months, I know they're sensible, I'm not going to sell the medication, because believe it or not, that does sometimes happen and is abused. Then if I know them and I trust them, I'll give them 6 months, because I feel I'd rather that than they're going to go anyway, they're going to stop their medication, come back, and I have to pick up the pieces when they come back. So
that's your policy. Is that a flexible policy depending on individual GPs?
Exactly. The government suggests 2 months, but I think it has to be a flexible arrangement.
Okay. And finally, may I ask who can get final prescriptions on the NHS?
Free prescriptions?
Yeah.
Yeah, that's quite historical actually. I'm not sure I completely agree with it, but it's anyone who's got a deficiency in a hormone, so which can be corrected by a drug, such as diabetics who are deficient in insulin, so they may need medication, or more medication or insulin. They get free prescriptions, or people with thyroid problems, because you can correct that with the drugs. But up until recently, cancer drugs haven't been free, but that has now changed, luckily. So I think it's just been in the last 2 or 3 months that that's been changed now.
That's great. Thank you very much, Siobhan. It's very
That's
helpful.
okay. It's a pleasure. Thank you.